Hello, Professor and classmates. I wanted to talk to you today about medicinal marijuana and it being the best treatment for many conditions and diseases. Although the name marijuana has been linked to illegal practices, the marijuana plant contains over 100 different chemicals when combined have been proven to have positive results. Medicinal marijuana is the usage of the marijuana plant or chemicals in the treatment of diseases and conditions. Recently, the advantages of the usage of medicinal marijuana have been brought to the forefront and has assisted in the decision to legalize medical marijuana in 30 states and the District of Columbia. 14 additional states are currently allowing marijuana usage on a restricted basis. Medicinal marijuana it can be used to treat conditions such as Alzheimer's, appetite loss in cancer patients, Crohn's disease, eating disorders such as bulimia and anorexia, glaucoma, high blood pressure, mental health conditions such as bipolarism, schizophrenia, and post traumatic stress disorder, multiple sclerosis, nausea, and chronic pain. The chemicals in marijuana have proven to also reduce anxiety, inflammation, as well as controlling the nausea and vomiting caused by chemotherapy and radiation. Further research has also shown that marijuana can be linked to the killing of cancer cells and slowing down tumor growth. One of the main side effects of marijuana is an increase in appetite, which also helps with weight gain, especially in those individuals battling cancer and the virus known that causes HIV and AIDS. Medicinal marijuana can be taken in various methods, from smoking it, inhaling it through a device called a vaporizer, ingesting it through edibles such as brownies and lollipops. It can be taken topically, where it is rubbed into the skin, especially on pressure points for those suffering from headaches and chronic pain, as well as placed under the tongue, where it's absorbed through the body that way. Although medicinal marijuana has not been approved yet by the FDA due to its need for further research, proving the positive effects outweigh any possible side effects. One of the main reasons for that is that marijuana is currently defined as a Schedule 1 drug, which is the same classification as highly addictive drugs like heroin and ecstasy. With that being said, the FDA has, however, approved two man-made medications derived of one of the primary chemicals found in marijuana, known as cannabinoids. Those drugs are known as Marinol and Sesamet. Both medications are currently being used in the treatment of chemotherapy patients. When I went through and researched the pros and cons of medicinal marijuana, it was amazing that I was not able to find many cons to the usage that were backed up by facts. Everything that was said negative about marijuana was based off of innuendo and just simply the name itself and the history of it being linked with illegal practices. If the truth were to be told, there is no record of any deaths due to a marijuana overdose or its usage. Most medications that are prescribed today to us have serious side effects that can be more harmful. Myself being a diabetic, the medications I'm prescribed, such as insulin, Inmilantis, and another medication I'm currently taking called Buturon, all have a side effect that could possibly cause thyroid cancer. Gives you a lot to think about. On another note, a more personal note, my father, who was diagnosed with stomach cancer and had to have an emergency surgery, which removed his entire stomach, 1/4 of his esophagus, and the tail of his pancreas. He wasn't able to tolerate any food by mouth. He had a feeding tube in. Had it not been for his oncologist prescribing medicinal marijuana, he would not have lasted as long as he did. With the marijuana usage, his appetite increased almost immediately. He was able to eat solid foods. He was able to come off of the feeding tube. He actually gained 10 pounds. All of this was due to the marijuana that was prescribed by his doctor. He was able to enjoy his final days with us, and he actually lasted a lot longer than what they gave him because he was able to eat and digest and tolerate regular foods versus the nourishment that he was trying to get through a feeding tube. I just have to say that medicinal marijuana has been proven to me time and time again to be of more benefit than harm. A final example I will use is my husband. He has suffered from high blood pressure for many years, and he's been on various medications, none of which have ever been able to control and keep down his blood pressure. He's been hospitalized many times due to his blood pressure being too high, and the medications they were giving him just simply were not working. He went to my doctor, who believes in the usage of medicinal marijuana. Within 1 month of strictly using the marijuana once a week, my husband is no longer on blood pressure medication. His blood pressure has come down and it has been stable. The list of the pros that I can tell you go on and on. And I truly believe the preconceived prejudice associated just off of the name is why there are ideas and judgments regarding the effectiveness and the positive outcome of the usage of medicinal marijuana. From me to you, I say you would be better off trying it and seeing for yourself versus strictly saying no and not have it backed up by fact. Thanks for listening and have a good evening.